Okay, in a previous video, we talked about the thoracic cavity with the ribs and the sternum. But if I want to talk about the rest of the axial skeleton with not thinking about the skull yet, that's going to come a little bit later, we have to think about the vertebrae. So we're going to talk about the vertebral column here, okay? So let's go ahead and get started with the vertebral column. Vertebral column really makes up about 2/5 of the total body height, okay? Um, the thing that's about the vertebral column that's really sort of interesting is it's really a very strong but flexible rod. It has a couple curves to it, and we'll talk about those curves. Actually, almost like a little bit of like a spring. The vertebrae are not perfectly straight up on top of each other, but it's curved, and I'll talk about that and why that happens. We know that the vertebrae also enclose the spinal cord, and the spinal cord basically is a connection from the brain to the rest of the body. Okay, so we need to have a very firm protective area for the spinal cord to sit in. I'll show you exactly where that is. We also know that the vertebral column supports the head. That's an important part, and also its attachment for a number of pectoral girdle and pelvic girdle muscles. Okay, so that vertebral column has multiple functions. It absorbs some shock. It provides a good amount of our body height. It encloses the spinal cord, muscle connections. Muscles are based or attached to the area of the vertebral column, supports the head. Okay, so basically it's multitasking all the time. Let me put it that way. Okay. Now, when we look at the vertebral column, we divide it up into regions. The first region is what we call the cervical region. Cervical, we know, means the neck. There are 7 cervical vertebrae. Okay. After that, we have the thoracic region with 12 thoracic vertebrae. Then we have the lumbar region with 5 lumbar vertebrae. Below that, we have the sacrum, which is down in here. And then we have the coccyx, which is basically a bunch of levels that are actually fused together. So the coccyx may have maybe a couple parts that are fused together, and we have about 5 parts that are fused together for the sacrum. But they still consider the sacrum as one bone and the coccyx one bone because they are. Now, I mentioned before that there are some curvatures of the vertebrae. If we look at the cervical area, it's concave posteriorly, convex anteriorly. Okay, so concave posteriorly, convex anteriorly. Okay, let's get rid of that stuff here. Okay, so we have that concavity posteriorly, convex anteriorly. If I look at my thoracic vertebrae, it's just the opposite. It's concave anteriorly, convex posteriorly. And then if I look at the lumbar region, it's just like it's very close to the cervical. It's convex anteriorly, concave posteriorly. And then the sacrum and the coccyx together mimic sort of the thoracic vertebrae. And basically they are concave anteriorly, convex posteriorly. And that gives me that curve that we see, mild curve, which actually acts sort of like a little bit of a spring. Again, if I have one vertebrae stacked directly on top of another vertebrae, it's not very stable. It doesn't absorb shock very well. This allows shock absorption a lot better. Okay, and so when we look at the curves, okay, we have 2 different parallel sets of curves. We have the cervical and the lumbar curves. So cervical, and lumbar, they're both heading in the same direction. And the second curves are the thoracic and the sacral. Thoracic and sacral, and they're curved in the same direction. Again, what these curves do is they increase the overall strength of the vertebral column because they're able to buffer a little bit of the forces there. So it assisted in maintaining balance. The vertebral column is shifting things around to be able to maintain balance. We'll talk a little about that later on. It's absorbing shock, almost like a minor spring-like action, and also that curve protect against fracture. Now, fractures do occur. A lot of the fractures that occur are going to be in the thoracic region, in older females with osteoporosis. What happens is instead of the body of the vertebrae being like this, they actually compress down. They become wedge-shaped, so it creates a big curvature of the back. Okay, we'll talk a little about that in a second with some of the abnormal curvatures that we see in the back. Okay, now in a fetus, this is looking at the fetus and the embryo. We basically have one curvature. It's one solid curvature that's going to be convex posteriorly, concave anteriorly. Okay, what happens is as time develops, these curvatures start to develop differently. Okay, we have what's called my primary curve, because my primary curve is basically going to be following and mimicking this curve. I think about my thoracic curvature and my sacral curvature, so they're still there. My secondary curves will develop a little bit later. in the fetal period. And that's when we start to get this curve here, my secondary curve, my cervical, and my lumbar curve. They'll occur a little bit later. So instead of, when we start out, we have a curve that's like this, convex posteriorly, concave anteriorly. But by the end of development, fetal development, all of a sudden I've developed not just a primary curve, which is this curve right here, but secondary curves, which now gives me that curved shape of the vertebrae, okay, which is good. Now, sometimes things go wrong, okay? Things frequently go wrong, and we end up with some what are called abnormal curves. And a couple things, one's called kyphosis, okay? And kyphosis, if I'm looking at, let's look at the one over here on the right where we have a whole adult. Again, if I look at my thoracic curve, there's a mild convexity posteriorly, concavity anteriorly. However, in a kyphosis, this curve becomes exaggerated. I have more convexity posteriorly, more concavity anteriorly, okay? And that's called a kyphosis. I'll show you that in just a second, how that looks. Lordosis doesn't involve the thoracic part of the spine, but involves the lumbar part. And what happens is now, instead of having it being concave posteriorly, a little bit convex anteriorly, it becomes much more prominent. They get this sort of swayed back appearance. They get a big dent in the middle of their back, and that's called a lordosis. Scoliosis, if I look at this plane right here, this plane right there is that sagittal, mid-sagittal plane. Scoliosis starts out on a frontal plane, and basically you won't see it here, but it's a side-to-side curve on the frontal plane, which then results in some rotation, particularly in the thoracic region, and everything becomes asymmetric. And let me just show you what we're talking about. This is a kyphosis, okay? And what we see is we see two people here with a kyphosis, and what we're seeing is a very exaggerated thoracic curvature, very exaggerated thoracic curvature, and that's not an uncommon type of thing. We can see the vertebrae, a very big curve. You know, where basically this should be a mildly curved. Now we have a much more significant curve thoracically. Now, frequently, like I mentioned, what really happens with this is you have the vertebrae, one vertebrae that lines up on top of the other, like that. And then what happens is, particularly with osteoporosis, this occurs later on, and it's not like a fall or a trip or anything like that. Frequently it's a coughing or a sneeze or a twist or a turn or a very heavy bowel movement, you know, have to strain a little bit more. What happens, it causes the vertebrae, because they lose their bulk from the osteoporosis, it causes them to sort of fracture down. It's called a compression fracture, and it goes like this. So in other words, now we're getting the vertebrae looks more wedge shaped. What that does is now this side comes down to this goes into here, and results in that increased curvature, okay? So we'll have a wedge like this, next to another wedge like that, next to another wedge, and it creates that large curvature in the back, which is a result, and that's called a kyphosis. So kyphosis is that exaggerated thoracic curvature. Now, lordosis isn't quite as prominent. I would say the one here on the right is a little bit more lordonic, but this is a little bit exaggerated lumbar curve. This is a little bit more exaggerated lumbar curve. You ever watch those little gymnasts when they come down from a dismount and they stand there and looks like their back is like in a different zip code from their stomach? And that's the lordosis. Lordosis is involving the lumbar vertebrae, okay? Where my kyphosis was thoracic, lordosis is lumbar, okay? A lot of times these can be strengthened with muscle and with you know, muscular activities and braces and stuff like that with the lordosis. Kyphosis is really difficult. Once they get those vertebrae that compress down, there's not a whole lot to do with that. I mean, it's always going to be a curve. My step grandmother had really severe osteoporosis and had just a monster kyphosis. Okay, she got to the point where we had to take her car away because she had so much kyphosis she couldn't see over the dashboard to be able to see where she was going, and then she'd hit other cars and stuff like that. So that's not a real good thing. So we said, guess what, Virginia, you're not driving anymore. Okay, so that's called lordosis here. Kyphosis is in the thoracic region. Now let's talk about scoliosis. Here's scoliosis, and again, these could be exceptionally dramatic. You know, most girls during from elementary school on are checked for scoliosis, and here we find, instead of being on that sagittal plane, this is on a frontal plane. So obviously you know that this is a frontal plane, okay? You see this very prominent side-to-side curve when the back should be straight, that way. Again, from front to back on a sagittal plane, we have the curvatures, but on a frontal plane, the back should be straight. Okay, in this case, it's bad. Now, if you look here, this causes so much asymmetry of the chest cage. This is the scapula getting poked out. It comes out, and the scapula is down. If you look here, there's the same thing. Here's a curvature, like very exaggerated curvature, usually involving both the thoracic as well as the lumbar area. And when you have them bend over, see the asymmetry of the chest cage? And this is the scapula being pushed up in there. Here's the vertebrae showing that very wide curve. There's a number of treatments. We can't get into this. Bracing. Put people in like a Milwaukee brace, which actually holds them upright and tries to stretch them out a little bit. And in many cases, as in this case right here, you actually see this. This is a dressing down the back. And what they do is they fillet the back. And then what they do is they try to straighten out as much as they can. And they put a rod in there, a Harrington rod, a metal rod, to try to keep the back straight. Anyway, so that's scoliosis. So we've talked about kyphosis, thoracic area, lordosis, lumbar, and scoliosis, both thoracic and lumbar. But where we have like lordosis and kyphosis on a sagittal plane, in the scoliosis, it starts out in the frontal plane, but because of the asymmetry that we see here, we also have some problems eventually that occurs with more advanced cases on the frontal, sagittal, as well as axial plane, okay, which creates all kinds of problems, and it becomes a nightmare. Okay, let's talk about what occurs between the vertebrae. Between the vertebrae are what are called intervertebral discs. Okay, and so here's a vertebral body. This is a body here. Okay, a body here. This is a body here. Same thing here, body here, body here. And in between there's a disc, okay? And this disc is very fibrous on the outside, and that's called the annulus fibrosus. The outer portion of that disc is very fibrous. On the inner side, it's softer. It's more gel on the inside, and that's called the nucleus pulposus. Nucleus pulposus. Well, it's good because what happens is when I have this pressure that's down on the vertebrae, it's able to bulge a little bit, almost like gel insoles and stuff like that. How they absorb some shock. The same thing happens with this with the disc, particularly with the area of the nucleus pulposus, the center area in the middle. Okay, so they do a couple things. Number one, there's a firm attachment to the vertebral body above and the vertebral body below, and it connects them pretty well. Okay, allows a little bit of a twisting type motion of the vertebrae, plus it also absorbs that vertical shock. Okay, and it'll broaden out, like it flattens out a little bit with compression when that shock comes down on it. Okay, sometimes it's a little bit too much. That's when they get what's called that herniated disc. What happens with a herniated disc, okay, the area of the annulus fibrosus becomes ruptured, okay, ruptured disc, herniated disc, and what will happen is it's not so bad when it goes this way, which is, this is going to be anterior, this is posterior here. These are those little bumps you feel in the back. Those are the vertebral spines. But what happens in a ruptured disc, in this gap right in here, okay, the spinal cord is going to go right through a canal. It's coming right straight down through there, okay? And what happens is when that disc ruptures, that disc pushes out, bulges. And what happens is through the holes on the side is where the nerves come out of the spinal cord. That disc then pushes against that nerve, and it pushes it against the bone. And as a result, that's why people with a herniated disc will have pain usually down the leg or distal to where the rupture is of the disc, because now that disc is pushing out and pushing against the nerve as it comes out through the hole between the two vertebrae. Okay, and that's what happens with a ruptured disc. Okay, this is just looking at a 3D CT, and we see the vertebral bodies right here, and then all of a sudden in the middle we see our disc in between. So all these little discs in between. A little bit of arthritic condition right there. You can see some arthritis right there. So this is L1, L2, L3, L4, L5, lumbar vertebrae, and we see the same thing over here. 1, 2, 3, 4, 5, and we're seeing the disc in this area, the disc in this area, disc in this area, and the vertebral bodies there. Okay, so that's what we see with that. Again, here's the same thing, looking, and we can see this is L5, 4, 3, 2, 1. Here's T12 right here. You can see the last of the floating ribs up in there. This is looking posteriorly, so these are the spinous processes. those little bumps you feel on the back. These are what are called transverse processes. We talked about that in the thoracic vertebrae when we talked about some of the ribs, what they attach to. And then you can see the discs back in there, okay? Now this is a picture, this is an MRI, okay? This is not a radiograph, this is an MRI. And basically this shows a couple herniated or ruptured discs. And they're circled here. Here's a bulging disc. What we actually see in this MRI, here are the vertebrae, okay? You could actually, that's easy to figure out, okay? Here's L5, L4, L3, L2, L1, okay? Coming down there, here's the sacrum. This is the sacrum down here. So this is the sacrum down in this area. And this area right here, let me do it in green. This is the spinal cord coming down here. That's the canal in this arch on the back of the vertebrae, and the spinal cord comes down there. And you can see at this point where the disc is rupturing, how it's going to push against the nerves as they come out of the spinal cord. You see the same thing there, and you see the same thing right there. It's pushing on that neural tissue. On the right image here, we see the same thing here. The white in here, this is the spinal cord. Let me just do that. Let me get rid of that. Okay, this is the spinal cord area inside there. Okay, coming down there, and you can see how in this area, like I mentioned right here, where that disc is pushing out, is pushing against that neural contents that causes the pain. Okay, so that's L5, L4, L3. This is L2, L1 right here. This is sacrum right down in here. Okay, so that's what happens with the herniated disc. Again, this is posterior. This would be anterior. Okay. Let's talk about the vertebral parts, okay? And all the vertebrae are similar in certain ways, okay? First, let's talk about the body. This area right here is the body. It's a sort of disc-shaped, and basically it's a large weight-bearing portion. The disc would be sitting in here. So in other words, here's the body, here's the body, here's the body, and then the disc is between each of the bodies, okay? So it has the superior and inferior portion are sort of rough. They're very rough, and that's for the attachment of the disc. So the disc will attach to this surface on the bottom side of that vertebrae, okay? There are also some holes on the outside anteriorly for nutrient foramen. What's a nutrient foramen? We talked about that before. That's where the artery goes into the bone to provide a blood supply, okay? I wouldn't worry about that too much, but that's the vertebral body. The one part that's really important is this area right here, and this is called the vertebral arch. Okay, it extends posteriorly. So again, this is posterior, this is anterior looking at the picture here. So it extends posteriorly from the body, okay? It forms a ring, and in the center of that ring is the spinal cord, okay? There's going to be fluid in there, or spinal fluid that's going to be around the spinal cord, and the spinal cord sits in there. And the nerves, if you look up here, okay, let me just show you right here. If you see the nerve, there's a nerve that's coming out between these little holes, between each of the vertebral arches on both sides. Like right out, it would be coming out. The nerve would be coming out from the spinal cord here and here. So in other words, the nerve would leave the spinal cord, be coming out through that little gap underneath that little arch there. Okay, so that's that. So the vertebral foramen contains. When we look at some words down here, the vertebral foramen. The vertebral foramen contains a spinal cord, has a lot of some fat in there, some areolar connective tissue which we know about, and some vessels, and that's the area filling in around the spinal cord. Okay, and that vertebral canal is the collectively involving all the vertebrae. So in other words, this right. If I talk about an individual vertebrae, this is my vertebral foramen. Okay, if I talk about all the vertebrae together, that whole canal, which is all those vertebral foramen lined up one on top of the other, that creates what we call the vertebral canal. Okay, and that's all the vertebrae collectively with the vertebral canal. Now, when I look at that archway, again, and the spinal cord is going to be sitting right inside of here, okay? Spinal cord sits right inside there. If I look at the archway, it can be divided into a number of different pieces, parts, okay? If I look at the pieces, parts here, this area right here that's in green, that's called the pedicle. That's called the pedicle, okay? Very short, you know, but it's called the pedicle. Next to the pedicle, okay, I have this part right here, which is called the transverse process. Transverse process. We talked about that before in the thoracic vertebrae. That's where part of that little tubercle on the rib will attach to the transverse process. So that's called the transverse process, okay? Purple out here is the lamina. That's the lamina right there. That's on that's the outer portion of that archway. And then back in the back, I have my spinous process, which is this area in here. Okay. The only other thing that we need to talk about that's in here is what's called the articular processes. Okay, the articular processes. So we have a superior articular process, which is this area right here. Let me just do it this way. This area right here and this area right here. And on the bottom of this arch, just below this, inferior to that, would be an inferior articular process, which would meet the superior articular process from the vertebrae below. Okay, so that's what we see. So that's all the parts: pedicle, transverse process, lamina, spinous process, lamina, pedicle, or transverse process, pedicle, and the articular facets. And again, this articular facet is going to meet with the inferior articular facet from the vertebrae above. Okay, and then inside I have my intervertebral foramen. Is actually the intervertebral foramen. This is my vertebral foramen, but my intervertebral foramen is on the side, and that's where the nerve comes out. You can't really see it on this particular image. So let's get rid of all these things right here so you can look at that again just to make sure. If I looked at where one vertebrae sits on top of the other over the body, as well as then the articular facets, the inferior articular process articulates or joins with the one on the superior articular facet here, then what's going to happen is there's going to be a gap, and that gap is between the pedicles, is exactly where pedicle from one vertebrae to the pedicle from the other vertebrae above it is going to be this intervertebral foramen, and that allows a spinal nerve to come out. So what's going to happen is that the spinal cord is going to be coming down at each segment between each vertebrae. I'm going to have a nerve that comes out, which is called a spinal nerve. Spinal nerve is going to come out between each segment like that all the way down. And it comes out right in this gap right here. There's going to be a little gap between the vertebrae. Okay, and we look at the processes again. This is the same thing that we talked about before. You know, this is the same thing as before. My pedicle, my transverse process, my articular facet, the lamina, and the spinous process. We've talked about that already, so we don't have to worry about these facets. Form what are called intervertebral joints, and they're flat. Okay, most of the facets they're flat to mildly concavo convex. Okay, one side would be concave, the other side of the vertebrae would be a little bit convex. It allows a little bit of rotation around these facets. So in other words, we can have a little bit of a twisting of vertebrae one on top of the other, but not a whole lot. You can't twist a whole lot. Okay, but that's that. Okay, spinous process is for a lot of muscular attachment and ligamentous attachment that will connect the spinous process or one vertebrae right down the middle of the back. Okay, if you feel those little lumps on the back being the spinous processes, if you feel between two adjacent ones, it'll be tight in there, and that's the muscle and the ligament that are connecting one spinous process to the other. Okay, but it's mostly for muscular attachment on both sides. Muscle is going to fill a lot of this gap in here between the the lamina and the spinous process. So that's, if you look down the back, you'll see the spinous processes come down here, and then the back will have a big hump on both sides. Okay, and that's a lot of muscle that fills in this area and fills in this area. Okay, this is just looking at a real bone. Okay, and you can see the parts there. You can see the body. I put all the little annotations in there. Here's my vertebral. Let me get me out of there so you can see that's the vertebral foramen. Vertebral foramen right here. Here's the pedicle. There's the pedicle that goes to there. Here's the articular process or facet. That's the superior. There's going to be one on the bottom side just below that. There's the lamina. There's the spinous process. There's the transverse process, and that creates that vertebral arch. Okay, and then the spinal cord is going to be sitting right in there. Okay, piece of cake. And then through this gap right here is where that spinal nerve is going to exit. Right between there. And again, you can see that what's going to be sitting on top of the vertebral body, that's where the disc is. So if that nerve is coming out this way, right through this little gap right there and that little gap right there, you can see that if the disc starts to herniate and bulges, it's going to push against that nerve that's there. It pushes against that area where the articular facet is. Okay, and that's a problem. This is just looking and showing what we were talking about just a second ago. What we see up in the top, up in here, this represents the spinal cord. The spinal cord would be right here. Go through that vertebral foramen. Here's the body of the vertebrae, and this is that intervertebral foramen. Again, this area right here, okay, the pedicle sits right here. And you can see how what's going to happen is here's the other pedicle, and between the two pedicles, pedicle here and pedicle here, is where that spinal nerve comes out, because you actually see that spinal nerve right here coming out. That's the spinal nerve coming out from the spinal cord, you know, just below that pedicle. Below the pedicle and above the one below. So then right here would be the disc, and you can see how if that disc in here bulges, it's going to push against that spinal that nerve, that spinal nerve coming out through that intervertebral foramen. Here's the spinous process, and you can see how it's connected by ligament between the two. This is just artificial. And then there's the lamina. You can see the lamina in there. Okay, so that's pretty easy to see. This is just a CT scan showing the vertebral body, the pedicle. Okay, here's the pedicle. Here's the lamina. These are the facet joints right there. That's a facet joint right there. Here's the spinous process. This is another lamina right there. That's the other pedicle. Okay, now in each region of the body, they're going to look a little bit different. Okay, cervical region is really sort of interesting because you got a couple special cases up in there. Okay, and again, how many cervical vertebrae do we have? We have 7 cervical vertebrae, and they're labeled C1 through C7. Okay, however, there's 2 that are exceptionally special. A couple things about them, just general comments, is they have a tendency that they have a very small body. The body is smaller. Oh, come on. My pen's not working quite right here. The body is smaller than the thoracic, but they have a bigger arch. Makes sense that vertebral frame is bigger here. Why? Because when the spinal cord leaves the brain, okay, when it leaves the skull, when the spinal cord leaves the skull, there's a hole in the bottom of the skull called the foramen magnum. When the spinal cord leaves there, it has all the neural fibers coming out there. But at each vertebral segment, it's giving off some. It's giving off some. It's giving off some. So it's going to be very wide cervically, and it's going to get a little bit more tapered and narrowed as we go on down the vertebral canal. So if I look at the cervical vertebrae, the body has a tendency to be smaller, but the vertebral foramen has a tendency to be larger. Okay. The spinous processes of C2 through C6 may be what are called bifid. Bifid means that they have 2 little spokes like a forked tongue. If you look up in here, you see a spoke there. See how they may be bifid. That's not unusual. Okay. Usually after C6, it's probably not like that, and we start to get more like this, a regular type of spinous process. If you feel the back of your neck, okay, right at the base of your neck, where your shoulders, just above your shoulders, you feel a little bump. Okay, you can feel the spinous process of the cervical vertebrae, but there's one that sticks out like a sore thumb. The one that sticks out like a sore thumb is C7. That's that one right there. Okay. The thing about it is we have a couple extra little holes in the cervical vertebrae. Okay, let me get rid of these here. We obviously have my vertebral foramen. Okay, my vertebral foramen for the spinal cord. But what happens is in the cervical vertebrae, they also have 2 other holes. This one right here and this one right here. And that would be where the transverse process basically should be. And these are called transverse foramen on both sides. Now these are really important. There's an artery that goes into the foramen magnum that supplies a good portion of the brain. Okay? And what happens is through these 2 little holes right here, these foramen right here, is an artery called the vertebral artery. Vertebral artery, okay? It comes off of the subclavian, which comes off the aorta, which we'll talk about later on in the year. You'll be able to get that. But through that little hole right here is the vertebral artery. Vertebral artery comes right straight up through that little hole. Okay, that's where the vertebral artery goes. It's very, very important. So if I would throw a cervical vertebrae down, you know it's a cervical vertebrae and not thoracic vertebrae. Why? Because they have a transverse foramen, which the thoracic vertebrae don't. And you can see it right here. See it right there's one right there. You can see one right there. You can't see these. These are sort of rotated around. Okay, and basically that's called that transverse foramen. Okay, now we have 2 special ones. Okay, C1 and C2. Okay, and these are special cervical vertebrae. We see the transverse frame in there, we see a transverse frame in there, we see a transverse frame in there, we see a transverse frame in there. But these are two special vertebrae. C1 is called the atlas, okay? And if you look right here, it's more of a ring. There's really no body. This is posterior, this is anterior here. The body should be in here, but guess what? There's no body, okay? And I'll show you what fills that gap in a minute. So there's a little notch. This area is sort of like notched right here. There's a little notch area right here where the body should be. This area right here is an articular facet. On the base of the skull, there are little things that look like little rocking chair feet. You know, the little round rocking chair feet, and they sit in these little facets. Okay, and those facets run from anterior to posterior. So therefore, what happens is what the skull does with these little like skid-like or like a bottom rocking chair. You know, the bottom of the skull comes like this. There's a little facet there, and these are like that, so they're a little hollowed out. They're concave. So as a result, that's what causes the head to move in this type of a direction. We slide that way at this joint, which is between C1 and the base of the skull. Okay, so it supports the head and allows sagittal plane motion, which is this motion here. We're on that sagittal plane. Okay, and again, if I look at C1, like it says on the left, it's a ring, you know, without really much of a spinous process. We should see a spinous process back here. We don't see much, and there's no body. There's no body to that vertebrae. Okay, but it does have these condyles right here, which allow the skull to sit inside there like a rocking chair. Okay, and that's called the atlanto-occipital joint. This would be the atlanto-occipital joint right here, because occipital is the portion of the skull that has those little rocking chair bottoms on there, okay? And this is the atlas. So it's called the atlanto-occipital joint, okay? That's C1. C2 is called the axis. And what makes it different from the other ones is right here, there's a thing that's called the dens, or the odontoid process. And basically, that serves as like the body of C1. The odontoid process sits in this open space. And what happens is right across here, from here to here, there's a ligament that holds the odontoid process in that spot. Okay? Now, people, when they have a neck injury, a cervical injury, they may fracture that off, which creates a bad instability, and it's frequently fatal. Okay? But what happens is this is like a peg that sits up in here. Now, what that peg does, it allows my motion, the head motion, to be a rotational motion, because now I'm rotating it around that peg. Okay, I'll show you. Oh, there we go. Okay, here's the atlas, here's C1, and right there's no body. But what sits in there? That little bump, and you can see it over here on the right-hand side. You can see C1, here's C1, the atlas sitting around here. And here's the vertebral foramen sitting right there. And here's C2, and C2 sits underneath it, but it has that little peg that comes up through that little dent in the front of C1, and it's held in there by ligaments that will hold that odontoid process or dens in the right spot. Okay, and that's important. So basically, I get my sagittal plane motion between C1 and the base of the skull. I get my rotational motion between C2 and C1 because that dens is like a pivot. So let's C1 rotate around C2. Okay, so the axis rotates around the atlas. Okay, excuse me. The atlas rotates around the axis. Okay, it's like the axis of a car, like an axle. The wheel rotates around there. So with that dens, or the odontoid process is sitting up there, C1 is like this. It's able to rotate around that dens, okay, or odontoid process. Okay, so that's what we have. That's the atlas, C1, axis, C2. The other cervical vertebrae, C3 through C7, they're about the same. They look about the same. Again, sometimes we have a bifid spinous process. This is the articular facet right there. Here's a vertebral arch, the vertebral foramen. Here's that transverse process for the vertebral artery, like we talked about before. Vertebral artery goes right up through the middle of those cervical vertebrae, and then when it gets up close to the base of the skull, that vertebral artery on one side actually meets with the other side and becomes what's called the basilar artery. So the basilar artery, and that basilar artery goes in through that little hole at the base of the skull, basilar artery, and this is the vertebral artery down here. Vertebral artery, and they meet and they go in through the little hole at the bottom of the skull. We'll see that in our next video. Okay. Again, that C7 vertebrae is basically that big prominent bump that we feel in the back of the neck. Okay, and that's what we got the cervical vertebrae. Again, C1, C2 special. They're really important and very, very important. When people talk about like cervical injuries and cervical fractures, a couple things is the diaphragm, okay, is supplied by nerves C3, C4, and C5, okay? And if I have a fracture that's above, that's at anywhere around C3, everything below that is gone. So therefore, what happens is they don't have the muscles, they don't have the nerve supply that goes to the diaphragm, and the diaphragm is exceptionally important in respiration. That's why these people also, when they get high up in the cervical vertebrae for fractures, is very close to what's called the brainstem. The brainstem controls some minor things like breathing and respirations and heart rate and stuff like that. So anyway, I'm joking, obviously. So this is just looking at the vertebrae. Here's C1 right there, no body. Here's that transverse foramen. Here's C2. There's the odontoid process or the dens. Here's C3. We see the transverse foramen all the way through all these, okay? And you can see how we start to get a body. When C2, the body is really basically the dens that fits up the odontoid process. Odontoid process dens could both be used. Sits up in that area held in by a ligament across here. But at C3 we have a body. C4, C5, C6, C7 we get a body, and you can sometimes see that bifid or that split spinous process. That's not really a big deal. And this is again looking at a typical cervical vertebrae, vertebral foramen. This would be the pedicle. This would be the lamina right here, spinous process, transverse process, transverse foramen, and the body of C3 through C7. Okay. And this is just looking at the lateral X-ray. Here are the bodies. Here's the spinous process, spinous process, spinous process, spinous process, spinous process, spinous process. And that's actually C1 is really not much of a spinous process, but just the ring. Okay. Here's another one. 1, 2, 3, 4, 5, 6, 7. This is 7. If you look here. Here are the spinous processes that come, and whoops, there's 7 way out there. That's why you feel that big bump on C7. So you can always tell where C7 is by that most prominent bump that is back there. The spinal cord would be fitting right in here. And so the spinal cord would be in that vertebral arch that sits back in there. This is just looking at it from an anterior-posterior direction. Here's the spinous process. You can see where that goes. Spinous process, spinous process, spinous process, and stuff like that. Pedicle, you can see where the disc would be between in there. Let's see, what else do we see? Vertebral body, not a whole lot here. I'll see it right there. Again, here's the same vertebrae, same thing we've seen before. Here's the trachea right there. You can actually see the trachea. It's there. This is an MRI. Just looking. Here are the vertebral bodies right here. Body, 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 body. Okay. So and then the nerve roots are going to be coming out in this way. This area right here is a spinal cord. Okay. Thoracic vertebrae. Again, we have 12 thoracic vertebrae. Okay. They're larger than the cervical vertebrae. Okay. And they're stronger. They're bearing a little bit more weight when we get to that point. The spinous processes have a tendency to be long and very inferiorly pointed. Okay, if we look at T1 is almost like a C7. Okay, spinous processes get really close, but once I get to T1 through about T2 through about T8 and even T9, the spinous processes are angled more downwards. Okay, so they're more inferiorly directed. When I finally get closer to the lumbar region, these are actually transitioning into more what looks like a lumbar vertebrae, where the spinous process will be more horizontal. Okay, so here's the body, 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 and all that area. It's out there, so we see where the body is, and the spinal cord is going to be fitting right in this gap, right in here, to that vertebral arch. And if I look, here's that intervertebral foramen right there, intervertebral foramen, intervertebral foramen, intervertebral foramen, intervertebral foramen, and that's where that spinal nerve is going to come off the spinal cord to go out to the rest of the body somewhere else. Okay, and that's the thoracic vertebrae 1 through 12. Again, we talked about how they articulate with the individual ribs, and this is a good view. So this is, this is one of the thoracic vertebrae. This one over here on the right. Let me look at this one right here first of all. And you see there's an articular facet right here, and there's an articular facet right here, articular facet right there. Okay, this one is the main one. Okay, it's called the superior demifacet. Demi means half, and this is, so let's say if this is, let's go back to our favorite, let's say this is T5. Okay, the fifth rib would attach right there. Okay, and then also the fifth rib, that tubercle will attach right there at that transverse process. Attach right there, would attach right there, and the rib. So the rib is going to be coming like that. It's going to be coming right there. What happens is we also have a smaller inferior demifacet on the bottom, and that would be where the upper portion of the head of the sixth rib would attach right there. The majority of the sixth rib is going to attach to the superior demifacet on the sixth thoracic vertebrae. Okay, so that's that. Here's my articular facet, which actually, the thing about the articular facets is when we look at them, one goes, they're angled this way. Okay, and what they do is the one on the bottom prevents the one on the front from going backwards, and the one on the front prevents the one in the back from going the opposite way. So as a result, they sort of lock themselves in like those flexible watch bands, how one link locks into the next link that locks into the next link, and that's what these facets do. So if I look at the facet, I'll have one facet like this, and the facet above like that, then down the one below will be like that, the one below that will be like that. So this one can't go this way because this is stopping it. So this can't go this way because this is stopping it. This one can't go this way because this is stopping it. Okay, so they sort of lock themselves in, and they can actually rotate a little bit around. Okay, and that's sort of an interesting thing that we see that. Okay, so anyway, that's the facets that we see on the thoracic vertebrae. Okay, when I finally get down to the lower, like I mentioned, when I talk about the lower thoracic vertebrae, we stop losing the one inferior demifacet because the ribs are becoming, when we're talking about 11 and 12, basically these floating ribs, they don't need the same level of attachment as 1 through 10. Okay, so we start to lose that demifacet on the bottom. And this is again just looking at the thoracic vertebrae, all labeled here. Here's a spinous process, transverse process, vertebral foramen. Pedicle is going to be in this area. Here's the pedicle. Here would be that intervertebral foramen where the spinal nerve comes out, and then we'd have one that's just above here, right there, for the next vertebrae above. Okay, so you could actually look at that when you get a chance. I'll erase that, and you could look at that when you get a chance if you want to look at it again. And this is again just looking at that thoracic vertebrae, where basically again here's the body, here's the vertebral arch, that's the pedicle right there. Here's the lamina, here's the transverse process, here's the spinous process, and then if we look laterally, here's the spinous process. Okay, let's see. Actually, no, that's not. I'm wrong. This is the transverse process. The transverse process is just hanging out a little bit different. I don't see a rib, so that screwed me up. Here's a demifacet right there. There's a demifacet. The rib's going to attach right there, and then there's the demifacet, or there's a facet right there. See that little area right there? Let me erase those. See that little area? Let me just put an arrow pointing to it. Little area right there and little area right there. That's where that tubercle of the rib is going to attach, and then the rib. The head of the rib is going to attach right there and right there. Okay. Here's the spinous process. Again, thoracic vertebrae, the spinous process are more vertically oriented. This right here would be the intervertebral foramen, and that's the area where the nerve would come out, the spinal nerve right there, because this area is the pedicle right here. Pedicle right here. Okay. So, and here's the disc. Obviously, that's the disc. That's the body. Okay, all those things should be pretty evident. You can always see that. Let me just erase that stuff. You could get a little look without all my little scribbles and stuff like that. So if you want to look at it again, that's all that. Okay, so that's what we see with this one. And if you look at a chest x-ray, a good chest x-ray that's properly penetrated. In other words, sometimes they have chest x-rays that are over penetrated and everything looks like it's black, it's much darker. And then they have under penetrated where everything is much whiter. What happens, a good chest x-ray, you could barely start to see the vertebral bodies. Okay, you can actually see the disc spaces between that. You should barely be able to see them through the area of the chest x-ray. So this is an appropriate penetration, and I would say that that's a good chest x-ray. But you can actually start to see the thoracic vertebrae, you know, the bodies of the thoracic vertebrae. Here you can actually see the spinous processes. See the spinous processes, and you should be able to see a spinous process there, spinous process there, spinous process there. There's one, there's one, there's one right there. Okay. Lumbar vertebrae. Lumbar vertebrae are big, okay, and they're big and they're heavy. Why? They're bearing more weight. What we're finding in the lumbar vertebrae, the bodies are getting bigger, and the vertebral foramen is getting smaller. Okay, bodies are getting bigger, vertebral foramen are getting smaller. They're very large and they're very strong because they're bearing a lot of body weight. Okay, the processes also are very short and they're very thick. The transverse process and the spinous process. The spinous process is big and thick and almost directed straight back. Remember the thoracic vertebrae, the spinous process were more vertical. And then finally, when I get down to about T11 and T12, they start to get more horizontal, so that what happens when I start to get my lumbar, the spinous processes are more vertically oriented. Okay, so all the processes are very thick. There's a little bit of a change in the articular orientation of the little joints, the intervertebral joints between each vertebral arch, but that's a little bit about that. Disc is in there. Here's the intervertebral foramen where the spinal nerves are going to be coming out. So anyway, that's a little bit about the lumbar vertebrae, but they're very, very big. Again, this is just looking at a lumbar vertebrae. The body is large. The vertebral foramen is much smaller because we've given off a lot of neural tissue on the way down. Okay, here's a very short, very heavy lamina. Here's the spinous process right back in there. Here's the transverse process sticking out. Hard to see. You can actually see the transverse process better here, and you see it better there. Okay, so this would be the lamina in here, and the pedicle would be in this area right here, pedicle, and again that vertebral foramen. Okay, it's it's all the same. A variation on a theme. Okay, they all except with C1, C2 with the big changes in the body. Okay, and this is just looking at what we see. So this is a vertebral, a lumbar vertebrae. So here's the body. Here's the pedicle. Here's the lamina. Here's the spinous process. Here's the transverse process here. Here's the articular facet, lamina, pedicle, transverse process right there, and the vertebral foramen in here. Vertebral foramen, and this is just looking at it. You can see how vertical. What happens? These articular processes become very vertical when I get down in the lumbar region. This is just looking at an X-ray. Here's L1, L2, L3, L4, L5, and you can see they're pretty big and boxy. Okay, here's that intervertebral foramen, intervertebral foramen, intervertebral foramen, intervertebral foramen, intervertebral foramen. What comes out of that? Spinal nerves. You can see the body. You can see the spinous processes coming out the back. So that's pretty much what you'd have expected. Quite large. The majority of the disc herniations do occur down here. When they do a lumbar puncture, okay, the lumbar puncture or spinal tap, they usually go right into this gap right here between L3 and L4. They take a needle and stick it between the spinous processes and stick it inside that inside that vertebral foramen to get the fluid that's around the area of the spinal cord, which is the cerebral spinal fluid. Okay, this is just looking at the same thing. Here are the transverse processes. Here's the spinous processes. They've already looked at the lamina and stuff like that. Okay, another one. Here's the spinous process, spinous process, spinous process, spinous process, all the way down. Transverse process, transverse process, transverse process. Disc area, disc, 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 and now we're going to be in the sacrum down here. Okay. Same thing again, you know, same thing. Here's the disc right there, disc, disc, disc. This is just a lateral view on a sagittal plane on this side. This is a frontal plane view in here. Okay. See the, you know, the little bodies of the vertebrae and stuff like that. This is an MRI. Okay, again looking. So what happens? This is posterior. This is anterior, and we're seeing the. So here's L5, L4, L3, L2, L1. Here's the spinal cord. You can see that the spinal cord is this whole darker area in there. That's the fluid around the spinal cord is white inside there. Okay. The cerebrospinal fluid that bathes the spinal cord, but you can see it right there, and you can see the disc spaces, see the intervertebral discs. Disc, 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 piece of cake. So you could look at that. It's all well labeled, so you could actually, let me get rid of this stuff. You could actually look at that when you get a little leisure time and to look at the MRI to get more knowledge in regards to that. This down and at the bottom, obviously, in here we're seeing the sacrum. Sacrum. Sacrum is sort of an unusual bone. It's more triangular shaped, and basically there were 5 sacral vertebrae developmentally, and they all come together. And what happens is it takes them a while. Usually by about by age 30, they're all together. Okay. Earlier on, you actually see them very segmented. Okay, a little bit together, but by about 30, it's just one solid bone. Okay, and usually before that. Okay, it's a very strong foundation for the pelvic girdle. We talked about that with the pelvis. We talked about the sacroiliac joint. It's on the back side of that pelvic cavity. In the female, it's shorter, it's wider, it's a little bit more curved between S2 and S3, which is down in this area right here, than the male, and probably just allows a curvature for that birth canal to be able to come out. It's the top is called the base. This is just an anatomical point. If I have something that's like this, okay, the wider portion at the bottom is always called the base. The pointed portion at the top is always called the apex. Okay, so this would be the base down here, and the pointed area is called the apex. So basically, the superior portion of the sacrum is wider, and that's the base, and the bottom portion where it goes into the coccyx is called the apex. It's called the apex. Okay, and this is what it looks like. It's more on the anterior surface. It's very concave. Okay, and it has these ridges, and these ridges are basically where those 5 bones, 1, 2, 3, 4, 5, actually merged and came together. Okay, and these are transverse ridges for all the sacral vertebral bodies came together. Okay, there are sacral foramina. Okay, here, 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 and here, 4 on each side. Okay, and basically they're for passages of nerves to come out. If you look up in here, this area will be a hole. There'll be a hole up in there with the spinal. Actually, the spinal cord, this is sort of interesting. People think the spinal cord comes all the way down to the sacrum. Wrong. The spinal cord actually ends around between L2 and L3. It comes down, and what happens, the spinal cord comes down and sort of comes out and rounds out like a little ball. Okay? And then at the bottom, it has a bunch of fibers that come off the bottom. Bunch of nerves that come off. This is called the conus medullaris, down at the bottom of the spinal cord. And then down here, all these nerve fibers come out like a mop. It looks like a horse's tail. Ooh, looks like a horse's tail. And they call this area down here the cauda, because caudal means what? Tail. Equina. Cauda equina, and that's the horse's tail. So when they do a lumbar puncture, a spinal tap, by doing it between L3 and L4, they're down below the solid portion of the spinal cord, and they're down here. Try to stab a noodle with a needle. It doesn't happen that easy, okay? So they have less chance of causing damage to the spinal cord by doing it by L3, by L4, okay? So that's that. This area right in here is called the sacral ala. or ala. And ala, like I mentioned before, means like this little flared areas. We talked about the ilium, the alar region of the ilium, the flared portion. Well, this is the flared portion right there, so that's called the sacral ala, or sacral ala, depends on how we put it. And this right here is called the sacral promontory. We talked about that before. It's when we go into that pelvic brim, okay, the sacrum comes out this way, and basically that's a little bit more convex out here in the front, and that's called the sacral promontory, okay? And that's what we see with that. So that's a little bit more of the sacrum anteriorly. We're talking about the anterior portion. The sacrum posteriorly, basically, this is where the spine, where the neural tissue is going to be going through that. So that's the sacral canal, and what's going to happen is the nerves are going to be coming out through those little foramina that we saw before. Okay, out the front, those little holes. Okay, so that's the sacral canal, continuation of the vertebral canal, but it's a solid canal as compared to, you know, each vertebrae having contributing to the vertebral canal, one on top of the other. Okay, so that's that. Let's see, what else should I say about that? Not a whole lot I could really say. They have the sacral hiatus, don't worry about that. Sacral corneal, which on both sides, don't worry about that. Sacrum's not really a very interesting bone. The only thing you want to probably talk about is the sacral crest, which is basically this little bump, which is basically the this area right in here where the fusion of all the transverse process and the spinal process. Okay. The auricular surface. Remember we talked about in the pelvis how we have the auricular surface on the pelvis? It's sort of lumpy, bumpy, and basically that's the area where the sacroiliac joint is. You can't really see it. It would be right on the inside of that, okay? And that's where the sacrum joins with the pelvis, you know, with the ilium of the pelvis, okay? Let's see what else I want to talk about. Not a whole lot here that's really all that important. Okay, with this, pretty boring. This is looking at the sacrum, okay? This is anterior. This is posterior. So you see, this would be the sacral promontory area right there. Here are those foramina, those four foramina. Here are those transverse ridges where the five individual, 1, 2, 3, 4, 5, all merged together. This is posterior. That's where the spinous processes were. They came to be fused together, and the transverse processes came to be fused there. That's the area, the sacral canal, where the neural structures go in. You can't really see it, but if I look just behind this area right in here, and if I look right behind in there, it would be that lumpy bumpy that, like I said, look like an English muffin. The surface is very rough, which makes contact with the alar surface of the ilium. Okay. And this is just looking at the sacrum right here. So here's L5 right here. Here's the sacrum. This is dorsal, this is anterior. Here's the sacral promontory right here, how it's sort of round. Like a promontory on something is like a ridge or a hill, and that's what we see there. Other than that, I don't think the sacrum is a really exciting bone. I don't care for it a whole lot, you know. It's there, but it's important because it does provide part of that pelvic brim. Okay, this is just looking at the sacrum. This right here will be the area of the sacroiliac joint. Okay, where that alar process would. Here are the foramen. Where the nerves will come out. That's about all I could say right there. Same thing, that one's even a little bit worse. You can't even see a whole lot there. Okay, now this is just looking, this is a CT scan, so you can actually see where all these 5 bones came together. So that's the sacrum right here. You can see how the 5 came together. So there's S1, S2, S3, S4, S5, and basically that's just looking at, that's a CT scan. Okay, this area back in here, right back in here, that's that sacral canal. The neural structures will come through there and come out through those foramen, through the holes, those 4 foramen on each side. Coccyx is the tailbone. And if I thought that the sacrum was sort of boring, I think the coccyx is even more. And basically, where the sacrum had 5 bones that came together, the coccyx is a fusion of 4. It's got a little rattlesnake tail that comes down in there, but it's solid. Okay, that usually fuses between about 20 and 30 years of age and stuff like that. C1, the coccyx 1 is the largest. It gets progressively smaller as it goes on down. Besides that, you know, and everything is sort of fused. In the female, it's pointing downwards. In the male, it points a little bit forwards. And the reason why it points downwards more in the female is because they want to keep the birth canal open. So if the coccyx aimed forward, it would be more of an obstruction. However, we do find in pregnancy sometimes the coccyx is a little bit more anteriorly displaced. As that baby's head comes down, crack, it pops it off, and they actually fracture the tailbone. So something to look forward to for the girls in the class that may happen. I don't know. Have to sit on a little pillow for a while or a little air ring or something like that to take the pressure off the coccyx. I've also seen a lot of people who like toboggan or something like that, and they hit a bump and they come down, they land on the tailbone, they fracture the coccyx off. Well, you can't stick them in a cast. So you know what you do with it? Say, you suck it up, Charlie. It's going to be fine. It's going to be sore for a while, but you know that's where it happens. So that's the coccyx. Not really a very exciting part of the bone. Okay, and there we see the coccyx down sitting in here. Piece of cake, easy. So what did we talk about today? We talked about the vertebral column. We talked about that there are a lot of things that are common for the thoracic, even for the cervical, most of the cervical, C2 through C7, T1 through T12, L1 through L5. We have a body, we have a vertebral arch with a pedicle, transverse process, lamina, spinous process, lamina, transverse process, pedicle back around. We have a vertebral canal, which is basically for the spinal cord to come through. Okay, we have a body which is large and heavy. In between the bodies of all the respective vertebrae are the vertebral discs or intervertebral discs. We have the spinal nerves coming out from the spinal cord to go to the outside through the intervertebral foramen between each respective pedicle. Okay, we talked about the special C1 and C2. C1 called the Atlas, and the reason we call that is that because, you know, mythology, Atlas was the one that held the world. Okay, held the world up. Atlas was the god that held the world up, and what the world was, it was round. Ooh, it looks like a skull. So it holds. So the Atlas holds the skull up, which is like Atlas holding up the world. Okay, and the axis is called the axis because of that little duns or the odontoid process that allows the Atlas to rotate around. Okay, so that's a piece of cake. So that's called the axis because it's like an axle. Okay, we talked about in the cervical vertebrae, you had those transverse foramina for the vertebral artery. That will make a lot more sense later on down the road when we get to the vascular structures. You'll see that that's going to be very prominent down the road. We talked about the sacrum being a pretty boring type. 5 bones that fuse together, still has a sacral canal for the neural contents, foramina for the nerves to come out of, okay? And the coccyx, which is, it's a coccyx, you know, who cares about the coccyx much, okay? If we didn't have a coccyx, we probably wouldn't miss it, okay? Let me put it that way. So that's what we talked about in regards to the vertebrae, okay? The vertebrae are allowed, they do have a little bit of movement. The vertebrae, we know that the vertebral column has a curve to it that allows it to absorb shock a little bit better. If we look at, this is looking at it from the sagittal view. On a frontal view, it's going to be a straight column. If we have a curve on the frontal view, that's called a scoliosis. If I have an exaggerated thoracic curve, that's called a kyphosis. If I have an exaggerated lumbar curve, that's called a lordosis. Okay, so we've talked about all those things. Again, as with all the other videos, if you have any questions, make sure you ask. I'd be more than happy to explain them to you. The videos are there. Look at them all you want. Share them with your friends and neighbors if you want. I don't really care. But if you want to do that, that's fine. You could have movie night and have everybody over and watch a video. I mean, if maybe, I don't know, maybe I have a lot of nerd friends, I don't know, but they're interested too. So anyway, that's okay with me. I have no problem with that. But anyway, if you have any questions, please let me know. And again, since there's no questions here because I can't answer them on the video, be safe and be healthy, and we'll see you with our next video. We're going to start to talk after these. We'll talk a little bit more about the skull. We'll probably talk about the cranium, then we'll talk about facial bones, and we'll talk about the cranial base. So I think there's another 3 that we'll be talking about in lab-wise. Okay, I'll see you then. Okay, be good.